Namaste. My name is Parnella and I'm an Ayurveda therapist with Union Yoga Ayurveda Singapore. Welcome to day 2 of the International Conference in Integrative Medicine, Yoga and Ayurveda for Cancer. Thank you for being here and thank you for your support. I will be your moderator for the next hour, and in this session, we will be learning from Ms Diane Finlayson. So, Ms Diane Finlayson is the Department Chair of Yoga Therapy and Ayurveda at the Maryland University of Integrative Health in America. She is a certified yoga therapist, trainer, hypnotherapist, and interfaith leader. She comes from a family of healers and educators. She is a precious gem with a wealth of knowledge and wisdom. In a time where stillness is a struggle, Ms. Finlayson believes that you can change and stand down from your daily battles with proper guidance. Today, she will share with us yoga and Ayurveda education for 30 minutes, followed by a Q&A session for 30 minutes. So without further ado, please give a warm welcome to Ms. Diane Finlayson. Ms. Finlayson, the floor is yours.
Let's just start by unmuting. What a good thing. So thank you, Parnella, so much. And I am so honored to be here with you and to have this opportunity to spend a little time and to speak to you about education and its importance for yoga and Ayurveda. I am also an Ayurveda, certified Ayurvedic practitioner in the US, and I will be very glad to talk to you about some of the requirements for certification and why it's important to have standards and to have those standards in a proper educational system. I'm going to share my slide deck with you so that we can look at these ideas together, and I'll talk a little about what's on each slide and why I think things are important. And then, as Parnella said, at the end we can discuss together the things that are of interest to you. So let's go here. Let's see, let's make sure I've got the right one. Yes, I do. So we're talking this evening about the importance of education for our chosen fields, yoga and Ayurveda. And at the university, the Maryland University of Integrative Health is one of the really only institutions in the US regionally accredited, and we'll talk a little bit about that, that is dedicated to integrative health modalities. So there are plenty of medical schools and there are what are called liberal arts schools. And our school is regionally accredited, so it's recognized as a college or university, and it gives degrees in integrative health modalities. The department that I manage, that I'm the chair for, is the yoga therapy department. And in this department right now, we have 1 master's degree and 2 certificate programs. The master's degree is a clinical yoga therapy degree, and the certificate programs are a PBC, a post-baccalaureate certificate. So that is something that people who have already done a bachelor's level education can come to us to learn. That is for Ayurvedic wellness practices. And then we're also just beginning to offer a post-master's certificate in yoga therapy for licensed healthcare providers. All right, let's go to the next slide. So I want to talk to you a little bit about why education is important, at least in the US, and then we can talk about whether it's similar in the countries you're from or not. So when we think about education in the United States in particular, we are a country that believes in credentials and degrees. And money, I will just say it, because it is a determining factor for a lot of what we're going to talk about and why things work or don't work, because everything, education is considered a commodity, healthcare is a commodity, everything is a commodity, and it has a price and things are bought and sold. In other countries, I am most familiar with the EU, so I can't speak to what's the Singapore system or other Asian systems, but in more state-regulated systems, as are common in the EU, education is not a commodity. It's something that people can simply have access to for the betterment of society. It's a little different in the West. So once you decide or have the money or find a scholarship and decide you'd like to go to receive a college degree, you go to a college or university. And that college then delivers a program in one discipline. And that is the difference. In a college, you have one discipline, so you might have a dental college or a business college or a medical college. Or you might have a university, which is fundamentally a collection of colleges. So a university creates an umbrella that holds all the small colleges. So you might have a state university system. That's very common. So each of the states in the US has a system to deliver higher education. And in that state university system, you're going to find multiple locations and multiple campuses or multiple programs. So you could go to, excuse me, the University of Maryland, and you might go to the dental school, or maybe you'll go to the liberal arts college. But you could go to a whole variety. You could have friends across the campus who are from different programs and different colleges within that university. So institutions also operate and grant degrees with just a state license. So there are two ways that a college or university can grant a degree. You can be licensed by the State Department of Education to grant a degree, or you can be accredited by a regional accreditation council. That's considered a little bit better. You can still do business with the Department of Ed and the state granting you the license to operate and deliver degrees, but it's not considered the gold standard, if you will. Institutions, so a regionally accredited university has gone through a really large vetting process. So to get a state approval, if you will, to deliver degrees, you do have to go through some vetting. You have to show that you're viable, that the degrees you're granting will allow students to go out and make a living. But with a university, you have all the programs looked at, all the curriculum get looked at, the finances of the school get looked at. If you're granting scholarships to students, that's looked at. All of your financial aid practices are reviewed to prove that you are operating with best practices and doing things that are ethical and in the best interest of the students that you're serving. So this is usually a non-profit organization. There are some for-profit universities and colleges in the US, and we look at them a little bit from the side of our eye. We're not so sure. The best universities, the ones you can trust to deliver a quality product, are generally nonprofits that are regionally accredited. Now, let's think about Ayurveda education. There are two organizations that provide accreditation for Ayurveda in the US. And those two organizations, not only do they accredit schools, but they also certify individuals to practice. And those are the National Ayurvedic Medical Association, NAMA, and the Association of Ayurvedic Professionals of North America. There may be some smaller organizations. These are the two I'm most familiar with. And NAMA, again, is sort of the gold standard. NAMA has done a lot of work. I'm not a spokesman for them. I am certified through them. Our program at the university is not extensive enough to be accredited through NAMA, so our university program, in addition to having the college be accredited, our program is professionally accredited by AAPNA. So you can also, in a college or university, have an additional professional accreditation for what you're doing. We see this in yoga therapy as well. There are different accrediting associations. In the US, again, the International Association of Yoga Therapy has a set of standards for accreditation for schools that want to offer a yoga therapy program. And then the SVIASA schools are working to develop an accreditation process as well. So when a program decides to go for a professional accreditation, the organization that accredits then reviews the curriculum to make sure it meets their standards. So then, if an individual graduates from a school with that accredited program, they are eligible to apply for certification. Now, most modalities, both in licensed healthcare and in yoga therapy and Ayurveda, I'm not sure about Ayurveda actually, that's interesting, but I do know in yoga therapy that if you have been practicing a very long time and you have the knowledge, you can sit for an exam, and if you pass the exam, you can be certified. So that's often called something like a portfolio review and examination. That's what IAYT does. And I know that NAMA has their board exam. I'm not exactly sure how they handle the portfolio review or if they are accepting Ayurvedic practitioners in that way. Nonetheless, so we've got our colleges and universities that have accreditation, and then we have professional accreditations as well. So why does education matter? If you want to be integrated into, conventional care in a country, it's helpful if the people who are running conventional care can recognize the way that you as an individual, as a healthcare provider, have been trained. So if Ayurveda professionals and yoga therapy professionals are not following an educational path that is recognizable in the West to licensed healthcare providers, then it's hard for the licensed healthcare providers who really do run much of conventional medicine. It's hard for them to understand if we are competent, if we are peers, or how to even think about who we are and what we do. So what does a licensed healthcare provider need to do in the West, in the US anyway? A licensed healthcare provider, in order to earn the privilege to practice their discipline at a hospital with their license, has to first be licensed. They get that license by taking a board exam that shows they're competent in their discipline. In order to be able to take that board exam, they have to receive a diploma from a regionally accredited school. And depending on the program, that could be 2 to 6 years of study. Now think about, I don't know what happens in Asia or even in the EU, but I will say in the US, many yoga programs and Ayurveda programs are a few hundred hours. So that's not 2 to 6 years of study. So what we're presenting is often not comparable to what a licensed healthcare provider is receiving. NAMA is working to set standards for schools that will make this more comparable, and having the board exam in place also helps make it more understandable who we are and what we're doing so that people can start to think of us as practical healthcare providers as well. So also additionally, if you want to enter a medical school, you've got to take the MCAT. You have to take a medical college entrance exam. And what that demonstrates is that you've got the aptitude to do the medical program and succeed. So often another element of that medical school are comprehensive exams. Those comprehensive exams often happen after the didactic material has been delivered. What's didactic? It's theoretical, it's kind of the foundations, it's the theories behind the medicine. And then there's a comprehensive exam followed by the ability to enter your clinical practicum, or you start working with real patients. So again, think about what we do. Often there's not a good clinical portion. So in the West, in the US, Ayurveda, yoga, and yoga therapy schools are rarely colleges or universities. So right now, it's my understanding there are 3 schools of Ayurveda that are granting degrees. I believe Bastyr still grants a Master of Science degree. The NUNM was granting a degree in Ayurveda, but you had to be in their naturopathic degree program as well before you could even take the Ayurveda degree. And then our certificate program, which is just a post-baccalaureate certificate. It's very small. And for yoga and yoga therapy, there are 3 colleges at the graduate level. Naropa has a bachelor's program, and there are 3 graduate level programs. And it's interesting. So the S. Vyasa Vivekananda University they're just opening for fall enrollment, and they're going to focus on research. It's going to be a Master of Science, but it's on research. Loyola Marymount has a Master of Arts, and their focus is philosophy. It's highly philosophical. And then the program that I'm department chair for is clinical. We train clinicians. So each of these programs, there are just 3, and they each have a very different focus. And the rest of the programs are what I call community-based programs, much like Union. Our programs, there are now globally 60 professionally accredited yoga therapy programs. And there are quite a number of Ayurveda programs that NAMA is professionally accrediting as well. However, let's think about this now. We're thinking about comparing to our medical friends. So let's compare to our medical friends. We don't have entrance exams to get into our yoga schools, and often there's no practicum. Often there's no comprehensive exam. Often there are separate tracks for yoga, yoga therapy, and Ayurveda. So there is certification, that's good, that's a start, and Ayurveda has a board exam available, but there's still limited practitioner acceptance, so not everybody does that board exam, and there's still no licensure. And licensure is a blessing and a curse. Anyone who is in a licensed profession with insurance will tell you, blessing and curse. So what would the ideal be? It would be ideal if the student would arrive to the school ready to study yoga and Ayurveda. Because don't the 2 belong together? The 2 really do belong together in so many important ways. It would be ideal if all of us could work together to create standards, forms of education that would allow us to create practitioners who are competent in both Ayurveda and yoga therapy, or who could at least assess and educate through both lenses. And we have to remember in whatever we're doing that the thing that sets us apart is the holistic nature of the care we provide. We must continue, no matter what, to see the whole person in front of us because we are in a patient-provider partnership. So how are we going to reach this goal? I'll wrap up. Right now, most yoga and Ayurveda schools, yoga therapy schools and Ayurveda schools are not regionally or state licensed. They're not regionally accredited. Most are lineage-driven small businesses, at least in the West. So they follow this teacher's lineage or that teacher's lineage, and they really are run as small businesses rather than as, you know, a really engaged educational institution. What do we need to work on to make sure we're turning out a gifted, competent practitioner? They've got to know Ayurveda and yoga tools and protocols. And I believe if we're going to be accepted and recognized in polite society, if you will, we have to know some biomedical sciences. We've got to know anatomy, physiology, neuroscience. We have to have an understanding of pathogenesis, not just the Ayurvedic ideas of how the body breaks down and disease is born in the body, but we have to understand the biomedical model, at least in a small way, so we can have a collaborative partnership with other Western or licensed healthcare providers wherever we are. We've got to have good ethics about what we're doing, so we are being ethical across our practitioner boundaries and our patient practitioner boundaries. And we have to be able to engage correctly with the public as well. There should be a good understanding of therapeutic relationship, what we call it the university healing presence. One of the things that will help on the biomedical sphere a lot, and will just really help all of us, is to create case studies and get some good scientific research for the field. Because if we are producing good research and sharing our case studies and our information globally, everybody moves forward, and the patient, who benefits? The patient benefits. Because if we are all doing well-controlled and practical experiments, if you will, case studies, researching protocols in specific ways, then we can share that with each other and really help the field blossom. And everybody's got to do practicum. What do the case studies teach? Well, they help the conventional licensed healthcare provider understand what we're doing. If we are in a peer-reviewed journal with our research, those licensed healthcare providers can pick it up or see it in PubMed, and they can go, wow, look, this works. And now I might be willing to partner with someone who's in Ayurveda. So it helps the conventional medical practitioner understand how we work. It helps us to be more attractive as a collaborator. And when we're looking at case studies, we learn more about how conventional healthcare providers deliver their work. And so now we know how we can get in and partner with them. So I'm talking a lot about partnerships because I think they're important. And they're important because how does research get funded, and how do we get our research in our modalities funded? Well, large institutions fund research. Universities, hospitals fund research. That's part of the importance of practicum. If we can find ways to partner with agencies, with hospitals, with other healthcare, behavioral health agencies, they can start to see the efficacy of what we're doing. We can demonstrate to those people our efficacy. They can get interested and then become interested in helping us create research that will further the profession. And then people can start understanding us better. We can create bridges for collaboration. I think sometimes that medical professionals feel, especially in Ayurveda, because it is a more, I'll say, invasive, it's a more hands-on modality than yoga therapy. I think that there's some competition and that Western medical professionals just don't understand, and they feel threatened sometimes by Ayurvedic practitioners and doctors. So quickly, here's what we do for our professional education. This is university level education. The Master's in Yoga Therapy is a 2-year program, and we do it, the students go as a cohort just like medical school does. You don't go part-time to medical school, you go. And this is, you go through 6 trimesters straight through with your cohort. There's no entrance exam, but you do have to have a bachelor's degree from a regionally accredited university. In the first year, you do your foundational theoretical learning. Then there's that comprehensive exam at the end of year 1. And that is the way to prove to the student, to themselves, and to the faculty that they're ready to go into practicum. That next year, the clinical practicum is all working with patients. We have a partnership with Johns Hopkins Teaching Hospital, and so our yoga therapy students can work doing acute care bedside yoga therapy. When they complete, they have a clinical master's degree, they can be certified with IAYT, and also have the ability to be registered at the advanced level in our yoga teacher registry, Yoga Alliance. There's a postmaster's certificate, as I said, that's coming up for licensed healthcare providers. That has a practicum within the healthcare provider's scope of practice. And then for our post-baccalaureate certificate in Ayurveda, these certificates are short. I would love to see us scaffold this up to a master's degree and offer a real practicum. But at this time, we're not yet able to do that because there is not yet enough interest in frank Ayurvedic medicine at this level to sustain a full master's, clinical master's program. So we don't have an entrance exam. You do have to have a bachelor's degree. We have 2 courses on basic foundational knowledge, and then 2 courses of practical application. One really on Ahara, nutritional protocols, and one on Vihara, on lifestyle protocols. Which one is succeeding the most? The yoga therapy program. Why? Because licensed healthcare providers understand how to collaborate with us. The VA system, our military system for veterans, understands how this can help with PTSD. To them, they get it. They don't get Ayurveda yet. We have a ways to go yet. This is also big work in addiction recovery and behavioral health. And again, why are the grads successful? Our graduates are very successful, especially in the VA system, because they're comparable. When they go in to get a job, they have a clinical master's degree. So those licensed healthcare providers with whom they're working, they understand what that person has been through, and they can see them as a peer. They're trilingual. They speak biomedical. They speak a little Sanskrit, because we want to have that foundation and appreciation and understanding of our tradition, and they can speak the language of the heart to the client. They know how to write notes. They know how to write clinical notes. That's really important. And they're collaborating rather than competing in that healthcare environment. And they do excellent work on chronic conditions. Now, what's holding us all back? Not being able to be reimbursed in the insurance system and not having licensure. There are not codes that can be billed for. And there's not the research we need. So we need to start creating research building case studies and moving forward in that way. That's it. Now, I see a lot of hands going up, and Parnella's going to help organize all those questions. Let's talk.
Thank you so much, Finlayson. That was really helpful. That was amazing. And I think everyone here who is attending probably has some form of dream or some form of career path planned in yoga therapy and maybe even in Ayurveda as well. So let's get this started. I see Victoria, I see you have your hand raised. Good morning. Please unmute yourself and please do ask your question.
Yes, hi Parnella, thank you very much. Dr. Finlayson, thank you so much for your talk. That was very informative. I'm sure everyone learns a lot of new things today. I've got a question regarding the case studies, and like you said, they're very important for partnerships with wider institutions. So at the moment, as I understood, there's a number of students who get a master's degree upon completion of your program. So from my experience, when you undertake a master's program, you produce a thesis at the end of it. So in itself, it's a case study in a way. Maybe I'm wrong, but it is.
May I just real quick? So ours is a clinical.
I'm getting to it. Yes. So, is there just not enough case studies? Are they not up to the standards? What's the main barrier for producing this legit case studies that would count as a solid literature body? You know.
So part of it is the mechanism by which they are produced and published. So if you're going to, so case studies, one of our courses at the end of the program is a case study course. And we work to train our students how to create an effective case study. If that interests you, IAYT does the Symposium on Yoga Research, and they present a lot of case studies and they talk about case studies. And Satbir, I think, is speaking during this conference, and he may have some information for you on that. So the important thing, if you're doing a case study, is to make sure you've got correct notes, make sure that you write it up in a proper format. You've got to have it in a, and you should have them peer reviewed if possible. So someone can ask you questions and you can fill in any things that are not standard, not clear. So there is the International Journal of Yoga Therapy, which does some excellent work in yoga therapy. And yoga therapy today is good for practitioners. But IJYT is a PubMed indexed, peer-reviewed magazine. And if you want to learn about case studies, that is a good place to start looking at yoga therapy research and case studies to learn how it's put together. Is that helpful, Victoria?
Yes, thank you thank you very much. It is very helpful. I'm just wondering why they're not, are these standards not followed enough for these case studies to contribute?
So part of it, I think, too, is that we're not looked on as official healthcare providers because we're not licensed. We're not degreed, many of us. So that's another reason why the education is really, really important, and really pushing our own standards so that we can go in and compete with those licensed healthcare providers and say, I've got good medicine, and let me show you this good medicine. You know, you're studying yoga therapy. You know how people are with, oh, I know yoga. And it's different. Yoga and yoga therapy are two different things, aren't they? The doctor says, you should do some yoga. Well, what does that mean? You know, so the patient then goes out and takes a hot yoga class and gets further injured. You know, or it's somebody with low back pain and they're going out to do vinyasa and it's just not right for them, right? So now we have more clients, but it didn't help the patient until they got to us when we're doing that one-on-one work with them. But people don't know. We have so much education to do. We have so much education to do as a profession. We have to educate healthcare providers who we are, what we do, and make sure that we are meeting standards that they understand so they can see us as credible partners.
Thank you, Ms. Finlayson. That was really helpful. Now I'll take, I see that I have another raised hand from Dr. Satyam. Dr. Satyam, please unmute yourself and ask your question for Ms. Finlayson.
Hello, Ms. Finlayson. Thank you very much for the nice explanation about the therapy programs. So something which always keeps all of us wonder that, is it really 2 years of this study, including case study? Here we call it as field work, or you can call it as practicum. So really that sometimes our student ask that, doctor, can't it be like 1 year, like it's 2 years, so long, which is sometimes very taxing. So can you please let our viewers and as well as to me know that why these 2 years, like minimum 2 years, which is quite long, but still why 2 years are needed?
So the students are asking you why 2 years are needed. So part of that I'm going to say is because if you want to learn something in depth, you have to spend time with it. And if you want to be recognized by other healthcare providers, you have to mirror the experience that they have had as well. And if they are spending 6 years and we are spending 2 years, they're still going to look at us as not having quite what we need, but at least we had some. So that's why it needs to be minimum 2 years, in my opinion. But that's, you have to have at least a year for the philosophical foundations, and you have to have a minimum of a year for the practicum. You have to, because you have to see a wide variety of people while you're supervised. It's much better to see difficult cases with someone, a teacher, a supervisor, to help you understand the case and move through it competently, than to be done in 9 months out on my own. I'm doing my own practice, and someone comes to me and I don't know. I don't have any peers now. If I'm in school, if I'm still in school, I have supervisors to talk to. I have peers who are in my class to talk to. I have support. So I think I would rather spend a little more time and money, hope to see some really interesting and difficult cases so that when I go out, I am confident that I'm competent.
Thank you very much for this. Just a follow-up question with this.
Please.
You and me, we know that we are actually pushing standards. We are not saying that we are the standards, but we are pushing standards to reach to that level. And locally, we don't have any recognizing authorities. So sometimes our students, they say that putting that much time, and then also we are not getting something called as recognized, you know, which
Yes.
I always tell them that it is not that everything is about you getting recognized now, but you have to mirror yourself to that level. So how much do you want to convey this message to our students or ongoing students or forthcoming students that today, even though we are trying to fix standards, but this is the real way to do that.
That education is the way to fix the standard? Yeah. You know, it's so interesting, the notion of standards and the notion of external professional standards. You know, it's important, I think, as a community that we agree on what the standards need to be. Now, there are various forces that are going to push from various angles that want to, and here's why I think it's important as a community that we develop our own standards and our own processes, because if we don't, external forces are going to come in and start trying to tell us what to do. So if we work together as a community and we share what we discover as far as what works for accreditation and standards, then we can become self-governing and move forward with autonomy. But if we don't do anything and we just all act wild and we just all do what we want to do, then eventually external forces are going to come in, and I think I've seen this in other professions with chiropractic, with massage therapy in the US. If you don't make your own standards, other people are going to say you're out of control, and either we're going to push you off, like midwives here, you can't practice, you're dangerous, or we develop our own standards and we stand up and say, we want a seat at the table. We want you to see us. We want to work with you. So that's my take on it. I think it's really important. I didn't used to, you know, back in 2000, I've been at this since the 90s. I've been at this a while. And I've had one of those lineage-driven small schools. And I've also worked in the university, and I've been a practitioner. So I've looked at it from a lot of angles, and I've watched different organizations come up. So I think that if we share with each other the standards that we're using in our countries with our populations, because everybody's got slightly different standards and slightly different school systems. But if we all share together, we can make a very strong modality globally. And it's a matter of ethics as well.
Correct.
I think it's a matter of professional ethics as well.
Yes, totally agree with that. Just one last thing here is, why is our students and viewers may like to know also that why biomedical ethics and something what we call it as pathogenesis is really important for them to learn, like which we emphasize that how this disease is occurring, what exactly is happening. So, and you have to reverse that pathogenesis in your entire treatment. So this is what we are trying to learn all the time. So from your point of view, can you explain to our viewers that why is it important to study pathogenesis, reverse pathogenesis, and biomedical thing where we talk about X-ray, MRI, and other report presentation kind of thing?
Well, because otherwise you're not doing anybody any good. I mean, how are you going to help people heal if you don't understand the process? You know, otherwise you're just putting, you know, you're just smoothing out the skin. It's nice that you take the stress response down. Yes, you've got to take stress response down to help people heal, but you've also got to know what the process is that's going on internally so that you can move from disease to health. So, you know, in Ayurveda with the 6-stage process, you've got to know where you are in that devolution or evolution. Are you moving down? Is it getting worse? Are you getting better? It also helps you understand whether or not your treatment is effective. If you don't know pathogenesis, you don't know if your treatment is doing any good. And frankly, if, you know, for Ayurveda, I don't do panchakarma. That's outside of my scope of practice. I'd love to learn to do Panchakarma, and I know people I refer clients to for Panchakarma. But for pathogenesis, I have to know where in that 6-stage process is my client, and do they need to go to Panchakarma, or can I help them with Ahara and Vihara? I don't want to entertain them. I want them to get well. And sometimes I can't do it myself. I have to have help from, someone who does the big guns. Or maybe they've got cancer and they've got a tumor. And before we do anything, that tumor has to be cut out because now we're past stage 6 and I can't reverse it. So let's get rid of the toxin, and then let's help the person heal. So that's why I think it's important.
It is definitely very important, yes. I completely agree. Thank you, Ms. Finlayson. Now we're going to take some questions from the chat. Evelina asked, what are the most accredited bodies of yoga therapy?
The most accredited bodies, I'm not sure I understand that.
I think what she's probably asking, what is the most recognized globally, I suppose. So say if you study in Singapore and you want to be a yoga therapist in New Zealand or even in America, what is the gold standard? Or like they'll look at it and go, okay, you're legit, I'm going to hire you. I think that's the question. Okay, so right now what I know is that Australia has a accrediting body. IAYT has reciprocity with that Australian accrediting body. And see, I think that's an interesting idea too. This idea of reciprocity globally. SVIASA is working on a global accreditation standard. I'm not sure. I think they might be a little limited in their scope. I don't see them providing reciprocity. And I think that idea of reciprocity is valuable. The British Wheel of Yoga has an accreditation that has reciprocity with IAYT. But right now, the International Association of Yoga Therapy is doing, I think, pretty good work in the accreditation realm. And I think it would be useful if the standards don't seem quite right for Singapore, for maybe there to be a group in Singapore that creates something that could have that reciprocity with IAYT as well. But I think that what they have laid out is very sensible. At least for the West it is. And I'm a big believer in, we cannot go in and put our standards on other people. We can discuss, we can talk about, we can work together.
We can work together. I think it's collaboration is key.
Yes, definitely. Thank you. Someone else, let me see. Gajanand from India, he has a question. India has a very complicated law to start an Ayurveda school. Can we collaborate and start an Ayurveda school with a foreign school like the one you are working with right now?
That is such an interesting question. Email me, I don't know.
Gajanand, you have your answer.
I'd have to talk to higher administration, but it is complicated, and it's so complicated. I have people come and want to teach for us who have a BAMS, but it's really hard to find the equivalency in the US. And again, I think part of the problem is that, boy, would I like that. But I feel like the Western medical professionals find it competitive, and I think they're a little scared of it.
They are.
Yeah, right?
Yes. Like I actually got like someone from the general public, like from a very big organization, from a wellness group, they actually said that it's too polarizing. And to talk about something like cancer and using integrative medicine, holistic practices, something that sounds almost out of this world and backward, sounds polarizing and almost impossible, that only modern medicine is the only way to go. But then how did modern medicine get here in the first place? It's from ancient practices.
Of
You
course.
just bring it forward and you modernize it, and then you do studies on it. You see?
Yes. Well, and the thing that gets missed too is, it hasn't been that long that we have since in Western conventional medicine that the telescope was even introduced. I mean, that was in the 1800s.
Yeah.
That sterile methods were introduced. That was in the 1800s, late 1800s. All of this Western conventional medicine is actually very new. And we, I think, have gotten down a rabbit hole and are only looking at the pathological mechanisms and the breakdowns in the cells, and we forget that the cells working together make up a whole being. And the whole being needs to be treated. I remember hearing a gentleman talk about trying different modalities, and the only modality, he had horrible back problems, horrible. And he had acupuncture, and he went to Western medicine, and the only thing he said worked for him was Ayurveda. The only thing that worked. He did panchakarma, he had specific Abhyanga treatments, and he was told to go chant. And he said, I don't know what any of that means. And the practitioner said, doesn't matter, chant, just go chant. And he got better. And, I think we get hung up sometimes too on the Sanskrit, that we have to know everything, and we've got to write Devanagari, and everybody's got to do it all in Sanskrit. And I think that creates a barrier for us as well.
I think there is the element of intention that gets forgotten as well.
Yes.
Because, when you do meditation and all that, you always think about intention. You always set an intention, you set your visualization, and the intention is the driving force behind your treatment, behind your therapy, behind anything you do, basically.
Yes.
Yeah. So when you talk about reciprocity, when you talk about partnership, that is the element that I feel is sometimes it's not given the consideration.
It's missing. We are not looked on as collaborators. And again, that in cancer care, our yoga therapy students do very well in collaboration in some of the cancer centers here. We have had partnerships with the Maryland Proton Treatment Center to do visualization, guided imagery, meditation with people, and it's been very effective. The Ayurveda, they're like, I don't know what to do. You want to give them herbs? No, you can't. No, we're giving them pharmaceuticals. Your herbs might interact inappropriately. No. So they just push back.
I see. That's a shame, but we'll get there. I'm sure
eventually,
we'll
I think we will. We will.
There's one more question from the chat, from Ami Shah. Is yoga therapy covered by insurance?
No, that's a problem. There's no billing code. We're not licensed, and there's no billing code. Now, the problem with insurance, so the good part about insurance is if you're licensed and you can bill, you can reach people who could not pay out of pocket. So under-resourced populations can receive your care, and you are not just treating privileged people. That's good. The problem is, if you take insurance and they give you a billing code, they may not give you billing codes for everything that you need to do. And then they want to tell you that you can only bill for certain things. And then the more you work, the more they cut back on what they're willing to reimburse you for. So I think it might be important for all of us to work together to find some business structures as well that will help conventional practitioners understand how they can benefit their patients by including us somehow in their practices. So, and not, you know, there are, what do they call them? There are fancy practices now where you can, you know, I can't think of what they call them because my brain just shut off. But there, you can concierge services, you know, you can get concierge services from a doctor and have special treatment and all of that. Well, not that. That's for wealthy people.
Yeah.
How about, can we create a partnership with a cancer institute that allows us to be paid as part of the treatment for whoever walks through the door? I think we've got to find some methods for that, because if we are doing professional training and education of 2 to 6 years, just like a licensed healthcare provider, then we need to be compensated at least as well as the lowest rung of the licensed healthcare providers. Not $20 an hour, like a base level yoga teacher. We need to be compensated appropriately for the skill and professional care we're providing.
Definitely. I completely agree. Which brings me to my next question, and we probably have time for only one question left. So if it's okay with everyone, I'll ask my question because I've been waiting. We have quite a number of people in their 40s and 50s who are looking to switch careers.
Yes.
So does age matter when you want to study to become a yoga therapist? Is age a factor to consider? Because that's one of the things they ask, because they get so worried that they can't keep up, because there's this general idea that yoga is only for like flexible people, young people, limber, you know.
Yoga therapy is not about asana.
Thank you for saying that. Thank you.
Yoga therapy is about all of it. Yoga therapy is about yama, niyama, pranayama, and pratyahara, and you know, and dharana, dhyana, about samadhi. And if we are not helping people with moksha, we are stealing from them. You know, the point of yoga therapy is not to fix your shoulder; it's to get you free. Anybody, and I think for that reason, some age is helpful. Because if you're a householder and you're in your 40s or 50s, you have lived some life. You have seen some things. You have some different understanding. And you have some compassion for the way a body can be banged up and the suffering that can cause. Now, of course, our aim is to relieve suffering, but we're relieving suffering so the individual can have liberation.
Thank you so much.
You don't need to be 25 for that.
Amen. Thank you so much, Ms. Finlayson. This was amazing. We've come to the end of the session. Thank you for spending this 1 hour with us. It has been amazing and very, very grateful for you, for all your presence, for your support. Thank you everyone for being here today. I wish you well. I wish you, Ms. Finlayson, well, and great success in whatever you do.
Thank you so much. I'm so honored to be part of this. Thank you.
Thank you, everyone. Thank you very much.